Okay, good afternoon everyone and welcome to UCL's Lunch Hour Lecture today. My name's Dr. Karina Fernley and I'm in the Department of Science and Technology Studies, and I am very delighted to introduce to you our speaker for today's Lunch Hour Lecture, Dr. Ilan Kelman, who is a reader in Risk, Resilience and Global Health at UCL and has a joint appointment between the Institute of Risk and Disaster Reduction and the Institute of Global Health. He is also a professor at the University of Agder in Norway as well. Now, he has a number of different research interests, but largely he's looking at linking disaster and health, including the integration of climate change into disaster research and also health research. He tends to focus on three areas, which he will be touching some of today. One is the disaster diplomacy and health diplomacy. Second is looking at island sustainability involving safe and healthy communities in isolated locations, and thirdly, risk education for health and disasters. Now, Ilan has authored a number of different publications. He has an extensive list, but I just wanted to highlight a few, one of which is his leading publication, Disaster Diplomacy, How Disasters Affect Peace and Conflict. And he's also edited a number of very useful handbooks that are used in the disaster risk reduction world, including the Routledge Handbook of Disaster Risk Reduction, including climate change adaptation, which is basically sat on everyone's bookshelf because it's such a great collection. More recently, he has edited a publication through UCL Press titled Arcticness, Power and Voice from the North, and this is really testament to his dedication to conducting interdisciplinary research and approaches to dealing with the complex nature of disasters and climate change. He's also worked with a number of different agencies, including the Council of Europe, the International Federation of Red Cross and Red Crescent Societies, and Oxfam, to name a few. So he has some extensive experience, some wealth of experience, and therefore I'm really delighted to present to you Dr. Ilan Kelman, who will be presenting his talk titled, What is a Disaster Today?, followed by a Q&A session. So thank you, Ilan.
Who here has been through a disaster? So some people. Do you want to yell out? Which disaster was it? Okay, tropical cyclone. What else? Landslides? What else? Earthquakes? What else? War. Interestingly, many people in the room will have actually lived through wars with global implications. Certainly not everyone here was around during the Korean War or Vietnam or even the Falklands, but what about the first Gulf War, or the second Gulf War, or the war against terrorism? It was also interesting to hear some of what was said, things like landslides, earthquakes, cyclones. But what about the wonderful air that we breathe in every day? The fact that you probably couldn't walk into this lecture theatre from any of the tube stops without passing someone who is homeless. Are these disasters? At the base level, trawling through hundreds of pages of academic writing, many professional manuals, and several dictionaries, the smallest number of words which I could come up with to define a disaster is 7. But we do run a master's program and a PhD program at my institutes, so we might set the students the task to try and reduce that number. Fundamentally, though, something happens, we cannot deal with it, and so we ask for help. This definition works at the individual level, it works at the international level. It matches United Nations, researchers, emergency services, and dictionaries. Certainly it does have some vagueness, situation, coping, and support. But when we use language, vagueness is very hard to avoid entirely. For me, at least, the principal power of these words is that they are hopefully understandable, they are somewhat intuitive, and they tend to work across many, not all, but many languages and cultures, which is actually not so true when we try to explain why this sort of situation might arise. To get a disaster, we bring together two peculiar concepts, hazard and vulnerability. Examples of hazards: Earthquakes. Volcano. Tsunami. In fact, some of the words we heard earlier, earthquakes, tropical cyclones, floods, landslides, some happen quickly, some happen slowly. Yet a changing environment by itself does not cover the definition of disaster. Because we saw in the definition, you had to have trouble coping with it, you had to have trouble dealing with it. So whenever we get a hazard like the ones which were mentioned, some people can deal with it, some people cannot deal with it. We need to consider this element of coping, how society deals or cannot deal with hazards. This element is called vulnerability, which is a societal process setting up people and places to be harmed by potential hazards. It could be poorly constructed buildings, planning regulations not adhered to, not having insurance, not receiving warnings because you do not speak the language, not being able to evacuate because you are sick or might have mobility differences from the aspects which are put on in order to effect evacuation. Perhaps you simply fear assault in an emergency shelter and you're too scared to leave home. And many other possibilities which might make it difficult to deal with a hazard, even when we know exactly what to do. The problem in this photo, which I took in Yorkshire, is not so much that it rained a lot, so an underground river rose. The issue was that a house was built over that underground river without flood measures. It's simply the fundamental philosophical question that if an earthquake happens in a forest when no one is around, does it make a sound? In fact, let's examine earthquakes some more. So, pub quiz time. Think of a number. How many people in human history have had their deaths caused by earthquakes? Come on, give me a number. Who's first? How many? 1 million. Lower. 0. That's a rather peculiar answer. Why 0?
Earthquakes don't kill people collapsing buildings.
In fact, many earthquake engineers and community workers have on their business cards, earthquakes don't kill people, collapsing buildings do. So basically almost no one in human history has had their deaths caused by earthquakes, even if it might be somewhat earthquake related. The earthquake occurs quickly. It's an event confined in time and space, but it took a long time and amorphous, vague societal processes for urban planning, building codes, planning regulations, lack of monitoring, lack of enforcement to manifest so that buildings collapsed and killed people. This base cause of the disaster results from human decisions, values, paradigms, attitudes, and behavior over the long term. In fact, this lesson from vulnerability is simply that Rome was not built in a day. What does that mean? Rome was not built in a day. It meant that it was built overnight. Anyone, what is this lesson? It took not one day, but several days, several weeks, several months, several decades. The point is that it takes time. 12th January 2010. Haiti. The Haiti earthquake. One of the largest earthquake-related death tolls. Earthquake-related, not earthquake-caused. One of the largest earthquake-related death tolls in human history. Also, thus far, the single day when the United Nations lost the greatest number of staff. But this disaster did not happen on the 12th of January 2010. The cause of the people dying was not when the earth shook on 12th January 2010. Instead, it took centuries of corruption, resource extraction, external manipulation, poor governance, and creation and perpetuation of vulnerability, mainly by the ex-colonial powers, but also with some Haitian elites involved, to lead to the situation where one day a fairly reasonable sized and shallow earthquake shattered a country. In fact, we hear so much about earthquakes and floods being dangerous. But it is really us who are dangerous in failing to stop buildings collapsing in earthquakes and floods when we know exactly what to do in order to stop them falling down. And it's the same with other hazards, including influences of the environment, such as climate change. So the climate is changing rapidly. We are causing most of it. Climate change warms the air. Warmer air holds more moisture. It will rain more. It will tend to rain in greater intensity. In general, the more water you get, the worse the flood, but this is actually not absolute, because there are a lot of connections, such as drainage, such as water storage, such as what happened over previous weeks and previous years. A flood, though, is not a problem anyway. If you stay out of the water, you're going to be fine. The key is that we do not stay out of the water, or we do not have options to do so. How many people here have an umbrella with them now? So in fact, some do and some don't. For those who don't, do you know what country you're in? So even amongst those of us who are relatively privileged, who can afford umbrellas and access to weather forecasts, we make different choices. And it's not that one is right or wrong, they're both legitimate. However, not everyone can afford an umbrella. Not everyone can afford access to weather-related information. Not everyone can afford to purchase the accessories which demonstrate the maxim, there is no such thing as bad weather, only bad clothing. We are poor, so we are forced to live on marginalized land. Money went to the military rather than local infrastructure, so there's no bridge across the river for kids to get to school. Kickbacks to developers. Let houses be built on floodplains without flood measures. In one place, neighbors objected and they publicized corruption on the town council, so they were shot. Yes, the climate is changing rapidly. Yes, human action is largely responsible. But climate change induces only flooding. Nothing more, nothing less. More than the hazard, more than the flood, more than the climate, human action is responsible for vulnerability to floods and for vulnerabilities to climate change. Vulnerabilities cause disasters. People who cannot afford to heat or cool their homes end up dying more in heat waves and cold waves. Climate change is changing the weather rapidly already, making heat waves more frequent and more intense. But this affects heat wave deaths only if we fail to implement policies to deal with heat wave deaths. We can implement those policies. Sometimes we choose not to. It can be tough regarding infrastructure upgrades. In recent heat waves in London, for example, the temperature on the tube exceeded the European regulations, to some extent, exceeded the European regulations for transporting livestock. But on the other hand, dealing with those EU regulations was easy. We held a referendum. The reality is that it is decades of underinvestment in public infrastructure, creating a situation where the heat on public transport can be dangerous. We have chosen to allocate resources elsewhere, such as cutting the entire tube subsidy from the national government. Even without climate change, if we don't take any action on the basis of cutting the subsidy, then we are creating vulnerability to tube users. The disaster is not what the temperature or rainfall is on any given day. The disaster is not the average temperature or rainfall across any given decade. That is simply hazard. The disaster is why we set up society to be unable to deal with a typical environmental event, such as an earthquake or landslide or air temperature or rainfall, so that it becomes hazardous and people start dying. And this is a fundamental idea behind what a disaster is, of course, with exceptions. And heat is one of them. Climate change is pushing us into a realm where the combination of heat, humidity, and time may actually exceed our ability to survive without indoor climate control. So it gets complicated, and we often have a long way to go in order to understand these interactions of the intricacies between the environment and society, between hazard and vulnerability. especially where hazards are substantially changed by human activity, such as through climate change, or such as through what we do when we engineer rivers and coastlines. But the real cause of disasters being vulnerabilities remains true. And this holds for the enormous catastrophes which hit all the headlines, like the Nepal earthquake, like the Caribbean hurricanes, like 1 centimeter of snow in London. And also holds for the wider, deeper, longer-term issues creating vulnerabilities: food, water, energy, livelihoods. Consequently, disaster is often assumed to be an event, i.e. the specific location hit by an earthquake in Indonesia, like the cities, hit by an earthquake and tsunami, like the cities in Indonesia, which we are seeing on the news at the moment. But in reality, the disaster is a process or a condition. We're talking about disastrous conditions. We're talking about vulnerability processes, inadequate water, food, and energy, gender and ethnic discrimination, poverty and overexploitation of ecosystems and natural resources. One consequence of it is, of course, climate change. But it is so important not to get hung up on the environment, not to focus on the symptom or manifestation, instead highlighting the true long-term cause. 26 December 2004. The Indian Ocean tsunami. Pacific tsunami warning systems started in 1949. International coordination around the Pacific started in 1960, leading to efforts in the 1970s to implement an Indian Ocean tsunami warning system. But it was always too expensive. There were always other priorities. We knew a major tsunami could happen in the Indian Ocean. We knew the hazard was there. We chose to do really little about the vulnerabilities. We simply made a decision that we weren't going to deal with the potential disaster until it was too late. So 18 months after the Indian Ocean countries were devastated, we had a fully operational Indian Ocean tsunami warning system. We are remarkably talented at preventing the disaster which just happened. And the understanding of what a disaster is does not always get through to those with the power to do something about it. So after the 2004 tsunami, a so-called intelligence analyst wrote the following: although devastating, the tsunami disaster is not likely to have a catastrophic impact on economies in the region. This is mainly because the areas affected, for the most part, were not industrial centers, but poor fishing villages and small coastal towns, places of limited economic value. Terry Cannon, a disasters and development researcher, retorted, "What their description ignores insults is the fact that millions of people have lost all their assets, domestic and productive, along with family members who are part of their economic livelihood systems, the children who would be supportive as parents get older, the networks that make the local economies work, and the infrastructure that permits the livelihoods to happen. This is the economy." Terry Cannon concluded his evisceration by writing, "This approach cannot go unchallenged, and it is precisely because some powerful people in the world who subscribe to this type of interpretation, and others who run these services for them, that the world is in such a mess." That is, this is why disasters happen. So deaths and injuries, the devastation to lives and livelihoods, flattened infrastructure, that indeed represented the disaster in Indonesia, Thailand, Sri Lanka, and elsewhere. But more so was the inability of powerful sectors to recognize or to openly admit why the disaster happened and what matters to people for their lives. Day-to-day assets, however small, day-to-day activities, however small, none remained in places post-tsunami. Permitting this to happen and then ignoring it afterwards, this is the disaster. Not the earthquake, not the waves. It is what happens all the time, every day, everywhere. Here's St. Lucia's attempt to avert an everyday disaster. In Barbados, I was told they could never bring in a drunk driving law because half the police force would have to arrest the other half. This is typical life. This is the everyday. These disasters rarely hit the headlines, yet they are a continual process, the ever-present conditions. They are not inevitable. We can choose not to drink and drive. We can choose not to text and drive. We can choose to subsidize public transportation. We can choose to support poor people in heating and cooling their homes. We can choose to implement earthquake and flood-related building and planning regulations and monitor and enforce them. At least, some of us can choose. Do we blame everything on ourselves or on those with the power, money, resources, and ability to choose who are paying to set the political agendas? Because as per the definition of disaster, disasters must involve people and societies. From the definition, it is simply about our ability to cope or not. Consequently, we prefer to avoid the term natural disaster, since they are really human-caused. So please, do not use the term natural disaster. Please do not use the term natural disaster. Whatever you do, please do not use the term. Thank you. I mean, even if we're going to consider space objects, imagine a comet or asteroid barreling towards the Earth, ready to generate a cataclysmic explosion, which might, or might not, have wiped out the dinosaurs and other mass extinctions. Well, we actually know what to do, right? Just give a Hollywood actor a nuclear weapon and send him into space. Actually, nukes are one option, but there are many more subtle and much more effective approaches to dealing with these objects. We are doing reasonably in terms of monitoring space and being ready to respond, but there's still a long way to go. It requires much more surveillance and readiness for action than we have at the moment, to be certain that we're not going to lose the planet. But it's our choice not to do it. It's our choice not to provide the resources necessary. So with some exceptions, dealing with nature is actually not that challenging, provided that we focus, do it properly, and sustain our actions over the long term. Long term. Rome was not built in a day. Port-au-Prince was not destroyed in an afternoon. These things take time, meaning that all disasters occur slowly. There is no such thing as a rapid onset disaster. There is no such thing as a sudden onset disaster. Some environmental events appear rapidly, the tornado, the landslide, but the disaster results from humanity's values, decisions, approaches, behavior, and paradigms over the long term. Disasters take a long time to manifest, even if it suddenly becomes apparent when a hazard appears. Disasters are not natural, and disasters are not events. Societal processes and conditions, culture and politics, including economics, they make or break the long-term vulnerability process, and hence the long-term disaster process. The fault, dear audience, is not in the environment, but in ourselves, that we are underlings. It also means that disasters are not the extreme, not the unusual, not the unpredictable events originating in the environment. They are the common, everyday, often unadmitted conditions in which we live and are often powerless to stop. Which means that in promoting these messages about disasters and trying to get action on them, we must be very careful not to make the sufferers feel blame or guilt. We can do real damage without proper care. Sure, you know what? It would have been straightforward to stop your house being destroyed in a wildfire. Why didn't you? Which is not a very helpful message if you've just lost your spouse and child in that wildfire. We could place blame and guilt on the perpetrators, the real perpetrators, those creating the societal processes of vulnerability, if we think that blame and guilt will actually move forward in terms of resolving the problem. And ultimately, we don't know the answer. So I really do need your help with these messages. How do the previous slides make you feel? Do the words back you into a corner because you think that you are at fault in a hopeless situation? Do they inspire you to run for political office, to change things? Does it sound like a clueless ivory tower expert, bestowing his logically brilliant but practically useless facts on the wide-eyed, interested, poor little audience? Or will you now learn first aid and examine your local authorities' planning regulations? I need answers to these questions, not just for here, but also because I'm attempting to write a book on the topic of this lecture. I believe that I have the science correct, and the science says disasters are not natural. Full stop, apart from all the exceptions and provisos. But this is based on decades of international work by truly brilliant people who knew this long before I was around. Honing the messages to convince, without diluting them, without disrespecting science, and without causing hurt, is the challenge. So please let me know your thoughts, because I'm generally sort of writing the book at the moment and trying to get it right. As a final illustration of what this all means on the ground, here's a photo that I took of a school shortly after a tornado in Texas. It demonstrates the reality of a disaster as a long-term, human-constructed process, not a one-off, unexpected natural event. Because what is a real issue? Is it the fact that if this tornado had gone through during school hours, many pupils and staff would have been killed? That's really easy to address. Some nails, materials, design, warning, regulations, knowledge, behavior, and ultimately wisdom to apply them all appropriately. Again, we can stop that school falling down, no problem at all. So perhaps a fundamental vulnerability, the overarching societal concern, the real disaster, which is so much harder to tackle, is that from a young age, in their place of daily education, the kids are exposed to a multinational corporation promoting sugar and caffeine. Thank you.
Thank you very much, Ilan, for a very thoughtful and reflective talk. So we have some time to take some questions. So if you'd like to put your hand up, then hopefully I'll be able to work my way around the room. So we've got one starting up there. Thank you. If you could just wait for a microphone. Sorry, there are a couple of assistants here who will come and pass a microphone to you so we can all hear. Thank you.
Thank you very much. So you talked about how it's made by decisions that we make, and often the decisions are made by people with the political power to do so. But the disaster that's prevented, that doesn't happen, doesn't make the news, and so doesn't have that kind of political incentive to do anything. Do you have any ideas how you should change that incentive structure, that you actually make prevention before things happen feasible?
Plenty of ideas, particularly for publicizing, not many of which have been taken up. So every year, several organizations publish a top 10 disasters of the year report. I've frequently said, why don't we publish a top 10 disasters averted of the year report? But no one's really taken that up yet. What we do know is that there are many successes, and at times we do get headlines for them. So what we've found is that there are many journalists who are amenable to these messages, want to support us in promoting them, and are willing to help us. So we did one study with my colleague at the back there, Bias Ahmed, in Bangladesh, where we actually did a cost-benefit analysis and showed that helping communities prepare for cyclones beforehand saved lives, livelihoods, and a lot of money. Based on that study, we published it in a peer-reviewed journal, so I guess about 3 people read it. And then we took that paper and turned it into a blog, which was published by Reuters Alert Note. And that was because the journalists understood the message, were interested in moving forward with it, and were supportive of us doing it. Ultimately, though, this is going to come from all of you. My Twitter, Instagram are up there. I'm on other social media. You can find me on the website. Promote not just my stuff, but Karina's work, because she's doing similar. We have many colleagues here from my Disasters Institute and my Global Health Institute. Look at our websites, put our work out there on social media. point out that for both health and disasters, prevention is better than cure. We have the numbers, we have the experience, we have the examples. We need all of you to join us in taking the work we're doing to promote it and move forward. And by working together, by collaborating, hopefully we'll be able to get these messages out there and shift the discourse from, oh, there was a huge earthquake and tsunami in Indonesia, let's get the headlines out there, to how many people are going to be saved by the Indian Ocean tsunami warning system. How many people are going to be saved by the Pacific tsunami warning system? How many people are saved when a huge earthquake strikes and there's no building collapses? And this happens frequently, but as you're saying, they don't hit the headlines. So we need you to join us in making those the headlines.
Thank you. Yes.
Hi, just as a vague thing, I know that there's lots of different disasters, but one of the things that wasn't specifically mentioned, and again, it might be a slightly different topic, was just around things like disease and epidemics surrounding those, because you are dealing with health preparation as well. That for itself, because there's so many different ones, and they are still sort of human caused as well, even if the virus itself is not. But is there any difference with that kind of disaster preparation, disaster management, because they are so varied and so different each time that there is an epidemic?
But absolutely. So viruses, bacteria, protozoa, prions, other microorganisms come from nature. They cause problems for us, often through pandemics or epidemics. So many of the health-related approaches absolutely apply to other hazards and particularly vulnerabilities. And similarly, a lot of disaster knowledge very much applies to reducing the risk of epidemics and pandemics, to surveillance, to monitoring, to response. So we always want more crossover, we always want more collaboration. There are many people working in the World Health Organization, many people working in governments who seek to cross over, and we have a very strong cohort of people who, like me, are appointed specifically to link disaster and health knowledge. So we have a number of blogs, a number of peer-reviewed papers looking at this, and many of the people are also in government or in agencies actually trying to do this effectively on the ground. So join us, be part of it, and see, well, what have we missed from the disaster side in health? What have we missed from the health side in disaster? This is where taking a master's, doing a PhD, collaborating with us on projects can actually go a long way to say, you don't have the freedom to break out of the institutional constraints. You don't have the freedom to break out of the organizational constraints and to get the health and disaster people talking to each other much more than we as individuals or we as a university are permitted to do.
Any other questions? Yes.
Hi, thanks for that talk. So in Bangladesh, there's this, I was working there for a while, and there's been a lot of disaster preparation, and one thing that we found is that even when there are cyclone warnings and disaster preparation, there's a lot of cultural norms that prevent people from actually taking on those. So maybe there's a cyclone shelter, maybe the alert's been given, but let's say a lot of women will feel more comfortable staying in the home because they feel a responsibility towards the home, or because the cyclone shelters weren't built with gender-segregated facilities, they're unlikely to go there. So there seems to be this other element of this preparation that's much more deeply embedded, and like how would you go about preparing that or sensitizing that or addressing these these cultural norms, I suppose?
My first step would be to talk to the people. Find out what they think, find out exactly what you're saying, what's actually going on, why do people react in that way, and what might they want. Then I'd also combine it with the knowledge we have already, because we have several decades of experience in Bangladesh and elsewhere on many of these issues. We have several decades of data recognizing how many lives have been saved, but there's still a lot more we could be doing. And by bringing together that on-the-ground experience from the people who go through the issues with the wider global scientific external knowledge, I would hope to work with the communities, with the agencies, with the governments, basically with the people, in order to try to improve the situation for them in their own on their own terms.
Any further questions? Yes, one over here. Thank you.
So when it comes to policy and regulation, when it comes to building homes and shelters and things that can withstand different disasters or hazards, like you said, how effective do you think changing policy is, and how do you think the government responds to things like that? And do you think there's a better incentive? Because oftentimes, especially I'd say in like third world countries, the regulation is there, but no one's really following suit with what's being said in the law. So how would you think what's a better way, do you think, to mobilize people to actually follow what is being said or change what is being said?
What we find is a lot of these issues, and particularly your question, are common across numerous geographies. So it's not really about the so-called developing developed. It's not really about the so-called first world, third world. We can go to, for example, Indigenous communities in Canada, which are in a far worse state than, say, slums in many of the tropical countries. So fundamentally, it's sort of your basic question, how effective is policy? And the answer is very clear and simple. It depends. So we need to look at each different context and try to see what's going right, what's going wrong. How much of the balance between voluntary and regulation is going to work in different contexts. Certainly policy, laws, regulation, and rules are part of the answer in almost every circumstance. They are very rarely all the answer. A lot of it really has to come from us, come from you, come from everyone, to pressure those with the power to make the changes that we want. But not everyone is necessarily an engineer, architect, or planner. We might not know the intricate details, which means that we do need experts on side, and we need those specialists and those with the technical skills working with the legislators to say, maybe here's a framework, which is partially voluntary, partly mandatory. Here's something which absolutely has to be mandatory, severe penalties, strict monitoring and enforcement. And there's simply no one size fits all. It's everyone working together, trying to pool our knowledge to ensure that different techniques are used in different ways and ultimately reach that success. Policy has to be there, but so much of that has to come from all of us pushing forward those with the power and the options.
Thank you for the talk, Dr. Ilan. I just want to have a question regarding these natural disasters, or let's say incidents because of natural hazards. So if you say that all these natural disasters do not happen, so all the incidents, or let's say all the fatalities, all casualties because of these incidents of natural hazards can be avoided. There is no such thing of fatalities because of these incidents.
Okay, sorry, your question relates to?
My question relates to this one because there is no natural disasters.
Okay.
So it is supposed to be no fatalities, no casualties because of this incident of natural hazards.
Oh, okay, so you want to know how do we determine when we've succeeded?
Yes, well, I'm trying to know whether because of this effort, there will not be any fatalities because of these natural hazards.
Okay, fundamentally, what do we want? And that's actually a very challenging philosophical question. Because in the definition of disaster, it did not specifically mention casualties, which may be a strength or may be a weakness. Are we aiming for 0 deaths? Are we aiming for 0 injuries? Are we aiming for 0 disruption? The definition of disaster does not answer that question. And I don't think as a field, I don't think as a society, we necessarily have a single answer to that question. So me personally, I tend to highly value individual life. But that's a culture in which I grew up in. In many other circumstances, people have responded saying that the way hazards were dealt with and the way disaster was dealt with, they experienced a fate worse than death. So number one, we need to say, well, how can we ever get ourselves into that situation? That's just ridiculous. But number two, how do different people, how do different cultures value different forms of death? So I would simply actually revert back to the definition. It's a situation which you need support for dealing with, for coping with. And that's going to be defined differently in different contexts, but it sets a debate for exactly your question. Are we talking casualties? Are we talking disruption? Are we talking changes in society? And then we need to collaborate, we need to work together to determine, are we going to quantify it or not? Are we going to have specific targets, indicators, and goals or not? What is the best way to achieve what we're aiming for? That a natural hazard does not lead to disaster, that we do not have vulnerability. And we've come from a long way to answer that, but we've a long way yet to go.
Okay, we have time for one last question, if there's any more questions. Yes, one last question, thank you.
Thank you. So, as you said, 40 years of scholarship on this issue and several snarky Twitter accounts solely dedicated to calling people out on the use of natural disasters. If I was to be devil's advocate, is a new book really what we need? Shouldn't we be setting fire to things?
It's not just the 40 years of scholarship, it's the 10,000 years of human experience. And do we need a new book to burn? I think that all of us should be conveying this message in different ways. Part of the task of being a scientist and being at the top research university in the UK is absolutely to write in English for an audience that can read English. So that is part of my mandate, and I'm willing to fulfill that. Can it stop with yet another tweet? Can it stop with yet another book? Can it stop with yet another lecture? Absolutely not. So we all need to go back in our own ways, think about our own cultures, our own ways of communicating, our own ways of engaging, our own languages, and take these messages and formulate them in such a way which it will work. One more book, I hope, will have impact. But it's up to all of you to buy 14 copies each in order for it to have impact. Again, the point is to take the message, reformulate it in such a way that it works. And I think that by tweeting, by using Instagram, by using Facebook, by giving lectures, by teaching on the master's program, by doing everything which we do, it is one small step towards that goal. Writing a book is part of that, but I need you to help me in many other ways, in many other fora, in many other communication venues in order to reach the audiences which I simply do not have the ability to reach.
Okay, thank you very much. So we really hope that you've enjoyed this lunch hour lecture. You certainly have a little bit of homework to do and go away in terms of reinforcing the positive stories that we hear from some events and spreading the word of the no natural disasters. This does not happen. So as usual, we've got the brain food. This is part of the brain food UCL series. We've got a lunch hour series. The next one is on the 9th of October, and it's called The Cosmic Dawn, The Quest for the First Galaxies. So very different topic. So that just leaves me to say thank you very much for coming today, and thank you very much to our wonderful speaker, Dr. Ilan Kelman. Thank you very much.